My name is Burke Shade, and presently living just south of Nashville, Tennessee.
I'm Susanna Shade. I'm his daughter, here helping him.
2 years ago, in June, I discovered a lump in my breast. So rare for men, 1%, and felt it, asked a friend who was a doctor. He felt it. He said, you ought to get that checked out. So I did a sonogram, ultrasound, and 95% malignant came back. So I did a biopsy, that came back that it was malignant ductal cancer. So that was a little over 2 years ago. So I did some alternative stuff for 2 years, but the tumor, and it felt great the whole time, but the tumor continued to grow. It just wasn't killing it. So that's when I started looking around for a place to go to stop the cancer, stop the tumor. I never got what was my condition stage on arrival? I never got a stage number. And Dr. Goodyear never classified it that way. But it was, about the size of a golf ball. It was protruding pretty much. You could see it under my shirt. And it was hard. When I started doing the health food stuff 2 years ago, what was soft got hard, and it's been growing that way. So it was hard, and it was getting in the way, sleeping and things like that. I found Brio by watching an interview of Dr. Goodyear on Dr. Mercola's web page. Dr. Mercola sends out a weekly email, and there was an interview in there, and I watched it. And I've always been alternative minded, and so Dr. Goodyear talked about the high dose vitamin C and the other treatments, and I thought that sounds like a great place for me. I didn't want to do chemo in terms of the normal way because my mother had breast cancer and my grandmother did, my two older sisters, and my mother always taught me if you destroy your liver, that's it. And so I've always shied away from treatments that would hurt my liver. So listening to Dr. Goodyear, he seemed, very concerned that you heal and not kill to heal. So that kind of won me over. I did look at other places, but settled here. Yeah, I think the other ones would have gone after the cancer, but didn't stress the healing of the whole body. And while I felt good the last 2 years, something was wrong in terms of my immune system. It wasn't killing the cancer. So I know I needed something that would kill the cancer, but also help my body stay healthy. And the other ones were more just dealing with the cancer and not the healing side of things, like all the therapies that are done here. So I thought, might as well do both. The IPT, which is the insulin potentiation therapy, which is low dose chemo. And what I've been impressed here is with the blood work and the blood test, they made sure my liver was in good shape so they weren't damaging it. And they gave me 5% instead of 10%. And so I haven't been sick, having any symptoms from that. And yet it appears that it's helping because my tumor is greatly reduced. So that's one therapy. Hyperthermia, I did some of those, whole body heat up things. You can look on the webpage and see. A lot of the sauna, ozone sauna, the intravenous vitamin C, melatonin, alpha lipoic. The vitamin B17 I was impressed with. My mom took that when she had cancer. And
Local hypothermia.
Local hyperthermia, yeah, is another treatment which heats up the tumor to 106, 170 degrees. And then a lot of the the pulsed electromagnetic fields. And y'all have about 10 different devices for that, getting it in you and around you and through you. I think that's probably most of it. And taking supplements, Dr. Goodyear right away put put me on some meds and then a bunch of supplements, and so I take those as well.
Dr. Kim.
Dr. Kim, different meds there, trying those out. The whole body hyperthermia, I just had a problem with claustrophobia, and the program is intense in that you're doing a lot of things and you do get, mentally worn down. And I did 2 hyperthermias. I just didn't know if I could do any more. So, but y'all have been very gracious, and Dr. Goodyear's like, well, if you don't want to do it, you don't have to do it. But I think they were helpful, and I've seen them help other people, but that was probably the most difficult, I'd say. It has, and I have to say that what I didn't like, a lot of the other places that I looked at on the internet, and I watched all the testimonials, and they always talked about how nice everybody was and how the staff was nice, but they rarely asked that question, has your situation improved? And they never talked about results. And I'm like, why would I want to go to that place? They don't talk about results. I don't want to go there and spend money and not get healed. Brio, that was one of the things Dr. Goodyear talked about in that interview, was that if you've come here and you haven't done chemo and you haven't done radiation or surgery, we can, the chances of helping you are a whole lot greater because your immune system hasn't been destroyed. And I thought, that's me, I haven't done that on purpose. And when I got here, he said the goal is no evidence of disease or no tumor in 6 weeks. That sounded great. And my tumor, as of last week, by the ultrasound, the doctor said it was 50% gone, and she thought most of it was dead. And I think, feeling it myself, it's about 80% gone, but it has definitely shrunk.
Yeah, it looks very, very different. It was a big ball that was protruding before, and now it's gotten much, like you can't see it through a shirt. It's gotten a lot smaller. And
so I think I've gotten great results. I haven't had a cold or anything while I've been here. I guess you take so much vitamin C, but I have felt good. It's exhausting at the end of the day. We both go home and take a nap, because sitting around and talking wears you out, but it's a good exhaustion. And in the mornings, I'm like ready to go. But, somebody said, one of the other patients said, killing cancer cells is hard. And I think all the therapies are helping to do that. So I'd say come. I mean, I've met both here, people who have gone the normal route and it wasn't helping them and they were in a lot of pain. The radiation 2 years later is still hurting and painful, and they've come here and the therapies a lot of these therapies are designed for those people to help them feel better. And that didn't affect me that way because I didn't feel bad already. But they claim, and I've seen them get better and better along the way. And then others have taken that stuff and I've seen other people improve. So from a terminal situation to they're walking and talking and happy. So, and then there are people here too that didn't have any evidence of disease, but the doctors want them to go back on chemo or do more radiation. And they're like, I'm done with that. And they wanted something more holistic, and they came here, and I think they've been very happy.
And there are people like you who have come, they just learned about their cancer and they're like, this is where I'm coming. I'm going to try to heal it naturally first.
Correct. And, I think that, and I'll tell you something else too, is I've met several patients. This is their second or third time here because they believe in Dr. Goodyear and what he's doing. And they came to another clinic he was at before and he helped them. But something happens and they come back and they're still getting helped. And everybody's cancer is different, whether it comes back aggressively or not. But they haven't given up on him. And so they're impressed with him, and that gives me confidence too that he's not a fly-by-night guy. And he definitely, when you have your interview with him, he's definitely prepared. He definitely knows what's going on, and he has a plan. So. But that came out in Dr. Mercola's interview. He knew the science, but I like the fact that he wants to think outside the box, and he's trying to do that and help people and not kill them. So I'm still here. I kind of said earlier I didn't like those other places. That's all I talked about. But the staff here has been great, and it's been a very good family experience. Completely different than a hospital experience. You're at a hospital, you're on their turf, and you do what they say, and you get out of their way. But here, you know, at times we're walking around, you know, the hallways with these, I don't know what you call these things, but the nurses have been great about, you know, getting out of your way and helping you through the door and walk in, and they've been sweet and they've been caring and kind and compassionate, very easy to talk to. We've loved them, and it's been great service. I mean, it's almost like it's not service, and they take jokes well, and you know, you can razz them and it doesn't bother them.
Yeah, I've been saying it's kind of like camp, because you come here and you meet all these great people from all over the place, and you're here for a long time, and so you see them every day and you interact with them, and you really get to kind of get comfortable and know people and develop friendships as well.
So I say thank you, staff. But
Yeah.
honestly, the thing is, they've been very good towards the family members too.
Yes.
And very, what's the word I'm looking for? Very helpful, but that's not the word, but very, yeah, supporting, encouraging, and you're not in a way, and you're here to help. We're glad you're here to help, and
yeah, they want you here. You know,
Right. So
they're not looking at you like,
great
why are
job,
you doing
staff.
that? Yeah, fantastic.
Okay, we'll come back. We need to.